There was an interesting meeting I went to last weekend with a couple of breast oncologists from Brisbane and Gold Coast. They had updates in breast cancer, especially with regards to the new generation of drugs called antibody-drug conjugates. It's an interesting class of drugs that came on maybe about 10-15 years ago. The first drug that went mainstream in the breast cancer was the TDM1 or Kadcyla. It's a complex drug which is a combination of antibodies and chemotherapy. So the antibody, the protein, drives the chemotherapy drug to cancer cell, and then binds to the cancer cell and then delivers the toxic load. So the first drug, Kadcyla, was bound to Herceptin, and it was used as a second-line therapy for women with HER2-positive breast cancers. Now, in the more recent years, there's a whole new generation of drugs that use the same mechanism. With the recent trials, now we found a drug called trastuzumab deruxtecan, which is also known as Enhertu, as a brand name, and it's shown to be markedly more effective than the Kadcyla, but it's also more toxic. What used to be with the old generation of drug is that the Herceptin binds to the cancer cell and then goes inside the cell and just kills that cell. These chemotherapy drugs are more toxic, and they not only kill the cell that it's bound to, but will kill a little bit of halo around it, so it causes that bystander killing effect of the cancer cell. And the practical benefit of this is that not all breast cancers are HER2 positive in a traditional sense of word, but there's a lot of breast cancers that have HER2 gene, but just not as highly as expressed as what we used to call HER2 positive. So the implications of all of that is that we are sort of changing the way how we diagnose and divide the breast cancer subgroups. We used to have them as ER positives, HER2 positive, triple negative, and triple positive, the ones that were also HER2 and ER positive. Now with this sort of new generation of drug, there's a new subgroup called HER2 low. So those are the ones that have HER2 expression, but not in a high level. Given that there's new drugs that is going to be targeting these specific types of cancers, that's certainly going to complicate the whole algorithm of how we treat, but it will bring more active drugs to a large proportion of breast cancer patients.